Right now, this is Ticker News Insight.
Hello and welcome back to Ticker News Insight, where we are looking to focus on the best of business with very clever people joining me from all around the world. I'm your host, Mike Loder, and to our latest story. And Alex Eisman is the founder and CEO of Genium, a software development and agile consulting firm that connects innovative companies with world-class software engineers across the globe. He's joining us today to talk about the future of artificial intelligence. Alex, it's good to see you. Thanks for your time.
Thank you.
Thanks for joining me. Now, we had a great discussion last time, so it's wonderful to reconnect. Let's go through a little bit more about artificial intelligence, and I wanted to start up with artificial intelligence imaging. Is that in relation to health? I suppose we're talking the health sector and their use of artificial intelligence at the moment.
Absolutely. There's a huge problem with the increase in population and demand for doctors. We've got to optimize processes and look at tremendous number of images, X-rays and ultrasound images. And that's where AI comes in, and they can bundle up together, help with imaging quality and detect early detection of certain things and processing massive amount of data and help with data governance and just optimizing the storage and diagnosis. That's where AI comes in, detecting what's good, what's not.
Well, let's talk a little bit about that further. So let's touch on assisted diagnosis. How exactly is artificial intelligence able to help doctors and help hospitals, I suppose, more broadly, identify the issues within the human body? It's incredible.
Right. It all comes down to the bundle of processes. AI imaging helps to start, right, detect where things need more attention, right. And then dedicating AI to educate patients, use virtual assistants to help doctors to get access to the most relevant information. And China is ahead of the game there. They have robots that help patients to read about their health. And after the discharge, they can educate them on certain things. That all saves time of doctors, which is valuable, and we're going to have more and more scarcity of that time.
Absolutely. And what about disease prediction? Artificial intelligence is able to actually predict based on a number of things. What have you understood to be sort of the main focus there when it comes to predicting what can happen to people?
Prediction is huge right now in the DNA sequencing, and that's where AI comes in. They look at samples of DNA and they can detect if a certain modification or certain mutation happened within the DNA, and they can process massive amount of data and speed up the detection. So just by doing a blood test, doing the DNA samples, AI can say that this needs attention, and then doctors can do the imaging, and then AI can actually look at images and see if the image is normal or needs even more attention. So that all speeds up the prevention and detection speed, and helps doctors to identify diseases much quicker at scale.
Yeah, it's certainly impressive technology when you start to break it down. But let's talk about health management as well. What did you want to touch on in relation to that? Is that sort of day-to-day operations and things like that? Or is that what you were talking about before when it comes to once they're finished, they've left the hospital and they're managing their health outside?
We all have wearable devices nowadays. Most of us have one way or the other, starting with your phone. And most of that data is processed by engineers or not doctors. What AI can do, and it started doing, is combining all those signals together and analyzing them as a whole. And that's where massive amount of data, where doctors cannot just apprehend all of the data together. That's where AI can come in and also diagnose and assist and monitor what's happening. If they see something off, that's where the alert can be triggered to doctors to start looking at things. A breakthrough technology really want to mention is that touches my personal story. I almost had a skin cancer, and I detected it early on based on my friend looking at the mole that was starting to evolve. And nowadays you have apps and technology that allows you to take a photo of a mole, and then AI compares it to millions and millions of sets of data and tells you if you should go and check it out or not. That's a huge step to scale up prevention and potentially saving millions of lives.
Exactly right. Hey, and just to finish for me, Alex, let's touch on drug development. There's obviously big pharmaceutical companies all around the world who might be looking to get involved in all of this. What have you seen in relation to drug development?
On average, a drug takes about 10 years to develop and $1 billion. And everything you can save in the time process there is huge and saving a lot of lives. And AI has been basically look at a lot of data, again, data points, and analyze what's the better way to develop a certain drug, what are the consequences, but also prediction of a certain molecular structures. And if you do that molecular structure, how it's going to affect your research and study, that's where you can tremendously accelerate the speed of the development. And if that drops down to 5 years, you're already saving a lot of lives there.
It's incredible stuff. Alex Eisman, thank you so much for joining me on the program once again to touch on everything that's going on in relation to artificial intelligence with a focus on the health sector today. Hopefully we can talk again soon, but thank you once again.
Thank you.
And of course, thank you to all of you for tuning in. I've been your host, Mike Loder. Be sure to head to tickernews.co for breaking news coming to you from all around the world. I, of course, look forward to seeing you all again very soon. Be well.